Ladies and gentlemen, welcome to Hall number 1 of LMHI 2021 Global Colloquium. The host nation for the session would be Malaysia and Thailand. I would also love to extend a very warm welcome to our Honorable Chairpersons, Honorable Dr. Sangeeta Duggal and Honorable Dr. Van Lop Tanketi. I would also love to extend a very warm welcome to our Honorable Moderators, Dr. Ibrahim Usman Masaikar. And I would also love to give a very warm welcome to all our speakers and all the delegates. To begin with the proceedings of this session, I would now request the moderator to please introduce the theme.
Hello, good morning, everyone. I hope okay. Yeah, thank you so much. Okay, so so we would like to go with our next session, and I'm really thankful to the LMHI team for giving me this opportunity to moderate this session. To begin with, today's session, so where the theme will be experiences in chronic disease management. So whereby four of very renowned speakers from India, Japan, China, so they will be sharing the experiences, the clinical experiences in managing chronic diseases with the research in the background. So to begin with, we have got our first speaker, Dr. Praveen Oberoi, so who will be sharing his experiences from research perspective, what we usually come across in day-to-day practice and what we see normally, some of the methodological issues in clinical trials in homeopathy, followed by Dr. Ronco, who will be speaking on homeopathy for Parkinson's disease patients. Professor Aaron, so he will be sharing a case series of HBsAg seroconversion with homeopathic treatment. And Professor Dr. Praful Barwalia, sir, he will be sharing his experiences in managing sensory processing disorders in autism, ADHD, and learning disabilities. So this is today's main theme, and we shall be beginning with Dr. Praveen Oberoi, who will be talking on methodological issues in clinical trials in homeopathy. Dr. Praveen Oberoi is a scientist level 4 from Central Council for Research in Homeopathy, India. So may we please welcome Dr. Praveen Oberoi to begin his talk. Thank you so much.
Thank you, Doctor. Thank you for inviting me in this session today. And can I share my screen? Am I audible?
Yes, ma'am, you are perfectly audible, and yes, you can share your screen.
Is my screen visible to you?
Yes, it is visible.
Perfectly visible. Please go on.
The topic of my discussion today is methodological issues in clinical trials in homeopathy. This is a very vast topic, big, because unlikely the other researches conducted under homeopathy, that is drug proving, drug standardization, fundamental and basic researches, which are organizational based and need the requirement of a particular organization, equipments and all. But clinical research is an area where every homeopath, whosoever is practicing, can lead into this particular research. And because this is related to human being and the participants are the human beings. Since the topic was very large And earlier also, we were conducting the clinical research studies and being published also. And because of the limited infrastructure at those times, I tried to concise my presentation to the last 5 years, that is 17 to 21, for this conducting the review of all those studies which have been conducted in this particular time, because at this time many of the guidelines were available, infrastructure in terms of investigations and all things were available to the practitioners as well as the researchers to show their results in the publications. To conduct my survey, I listed down from the PubMed search, because this is the most common surveys, PubMed surveys, including all the studies into the taking into the account. And while conducting my search, I searched clinical trials, cohort, clinical research, systemic reviews, and homeopathy. And in this study, I could find 177 total studies, out of which 91 were duplicate, 65 studies were conducted for enrollment in this particular area, and 6 studies were for protocol guidelines. Coming to the evidence-based from highest to low evidence, the systemic reviews were found to be 11, randomized controlled trials were 28, and controlled clinical trials and observational studies were 17, and case reports were 3. And none was as per the expert's opinion. Now, seeing the limitations of these studies which were conducted earlier, there are clinical trials of homeopathy in urological disorders. A systemic review was conducted, and wherein 4 RCTs and 14 observational studies were included in the study. But the results of the study showed that lack of adequate quality data from randomized trials hindered to arrive at any conclusion regarding the efficacy or effectiveness of homeopathy in urological disorders. The findings from the RCTs remained scarce, unpowered, and heterogeneous, had low reliability overall due to high and uncertain risk of bias and substandard model validity. So conclusion was well-designed trials are warranted with improved methodological robustness. Another review of bronchial asthma, here also we could find, though clinically the patients were improving, but adequately not supported by level A evidence. So the trials were rated as 1A and 1B. They still suffered from many important caveats, including inadequate power, sample size, and less robust designs in terms of randomization, blinding, and choice of outcome parameters. Independent applications and further evaluations in appropriate and rigorous designs are still warranted. This was the study systemic review on use of homeopathy in dentistry. The clinical trials selected showed positive effects on oral health. However, when they were critically evaluated, it was possible to recognize qualitative failures mainly related to double blinding. So it is necessary to encourage research on the subject using standardized methodological procedures to obtain better evaluation of the clinical applicability. This was another study for homeopathy for treatment of irritable bowel syndrome. Here also, though the results were found effective in homeopathy, thus no firm conclusions regarding the effectiveness and safety of homeopathy for the treatment of IBS can be drawn. Further, high quality, adequately powered RCTs are required to assess the efficacy and safety of clinical and individualized homeopathy for the IBS compared to placebo or the usual care. Systematic review and meta-analysis of randomized other than placebo-controlled trials of individualized homeopathic treatment. This also show a low quality, the small number of and heterogeneity of studies, and the current data preclude a decisive conclusion about the comparative effects of individualized homeopathy therapy. And future observational controlled OTP trials, controlled trials in homeopathy should aim as far as possible to promote both internal validity as well as the external validity. There was another study, randomized double-blind placebo-controlled trials of non-individualized homeopathic treatment, systemic review and meta-analysis. Here also the quality of the body of evidence was very low, and better designed, more rigorous RCTs were needed in order to develop an evidence base that can decisively provide reliable effect estimates of non-individualized homeopathic treatment. Another study of upper respiratory tract infections in children, a systemic review and meta-analysis. Here also we had the effectiveness of homeopathic remedies for childhood ARITs is not supported in high quality trials. Now coming to the reasons of these type of results, what we have seen in these all systemic reviews, it is that the methodological issues conducted in the trial and the studies were too heterogeneous for comparing homeopathy as a whole, because in some of the study there were RCTs, in some of the studies there were observational studies, in some of the studies there was single blinded, some double blinded, and this heterogeneity led to this type of results and reliable evidence in condition specific meta-analysis. Further, the evidence was also not available, and few studies in specific clinical conditions were available, because of which these type of results were observed in the systemic reviews. And to see how can we improve our meta-analysis, we have to obtain a clear research strategy. Whatever we are having, whatever study we are going to conduct, we should have a clear aim and objective, and what to include in the aims and objectives, and how to include is also very essential. So our research strategy should be very clear, and more studies with different designs within RCTs on different clinical conditions for a good systematic review or meta-analysis are to be conducted. And more rigorous, well-designed RCTs in different conditions for systemic review or meta-analysis are required to be done. Here I have taken only a few examples of meta-analysis which I have searched from because of the paucity of time. Otherwise, every study we can see and we can look into that. These are the then RCTs conducted. Homeopathy treatment as an add-on therapy may improve quality of life and prolong survival in patients with non-small cell lung cancer, a prospective, randomized, placebo-controlled, double-blind, 3-arm, multicentric study. In this study, we could find good results, and quality of life was improved significantly in homeopathy group compared with placebo. In addition, survival was significantly longer in homeopathy group versus placebo and control. A higher quality of life might have contributed to the prolonged survival. This study suggests that the homeopathy positively influences not only quality of life but also survival. Further studies, including other tumor entities, are warranted. This was a good study what we have seen in this area. Then another study, double-blind evaluation of homeopathy on cocaine craving, a randomized controlled pilot study. Here, this study was a very challenging study because of the field in which we were conducting the study. Due to high dropout rate and risk of bias, further research is required to confirm our findings with specific focus on strategies to increase the patient retention. Basically, in this study, what we could see is the patients who are drug dependents are very difficult to control and to stay with us. And this requires a major area which has to be taken care of. Another study, effectiveness of homeopathic medicines as add-on to institutional management protocol for acute encephalitis syndrome in children, an open-label randomized placebo-controlled trial. This study was planned by our CCRH, and I was one of the coordinators and investigator for conducting this study. And this is a disease with high mortality rate. And while planning the study, we intended to conduct this as a double-blind study at the initial stage to have the, because it was to be conducted in a allopathic hospital, BRD Medical Homeopathy, BRD Medical College, where it was an allopathic hospital with an ICU facilities where the children of this particular disease were treated. And they wanted us to have a double-blind strategy. We prepared the protocol accordingly. And after preparing the protocol, what was seen is while planning to conduct the study at a practical level, we saw that the patients were in a very acute and very acute stage, and double blinding was not possible. So our Director General at that time told that no, let us have an exploratory study first. So we conducted an exploratory study first, having good results in the homeopathy arm as compared to the institutional management treatment. Homeopathy arm along with institutional management treatment as compared to the institutional management treatment, which was available in the ICU of the hospital. And thereafter, we conducted the proper study with an equal sample size, and we could see that the effect of the homeopathic medicine in institutional homeopathic treatment as an add-on therapy, where the mortality rate could be reduced to 15%, more than 15%. And the patients who were taking only institutional management treatment, mortality rate was higher there, very, very higher there. So we, while preparing or the article for preparing the manuscript, we mentioned that further randomized control studies using double-blind trial design are recommended to discover if current findings may be corroborated. We mentioned this because we earlier intended to conduct the double-blind study and to satisfy our conventional part also, that yes, this is there. But while discussing with the statistician for the further studies to conduct as double-blind study, he said, no, we cannot conduct double-blind study here because double-blind death is death. There is no bias in the death. And your results are already quite significant. And why to need more time and money for conducting double-blind study? So this double-blind study was not conducted. And he desired that the results should be, the effects of the medicine should be given to the patients for the benefit of the patients. This is another study, individualized homeopathic medicine in chronic rhinosinusitis, randomized double-blind placebo-controlled trial. Here also there was a small but non-significant direction of effect favoring homeopathy, which ultimately renders the trial as inconclusive. Rigorous trials and independent replications are recommended to arrive at a confirmatory condition. These were another RCT where double-blind placebo-controlled pilot trial of individualized homeopathic medicines in the wards. Though it is said that homeopathy medicines are being treated very effectively in the wards, and all the practitioners, whether it is an experienced one or non-experienced one, are having the experience of treating wards successfully. But while conducting the study, as regards the preliminary study was inconclusive with a statistically non-significant direction of effect favoring homeopathy. So there are some lacunas while we are conducting the study which have to be taken care of, because though we are treating the patients effectively, but in getting the results in a particular study, we are not getting the effective results. Another study is efficacy of individualized homeopathic treatment of insomnia, that is double-blind randomized placebo-controlled trial. The individualized homeopathy seem to produce significantly better effect than placebo. Still, we want to have rigorous trials and independent replications are warranted, which is the need of the study. The major issues in these RCTs are that effects are very small, especially if compared to placebo controls. They are expensive to conduct. Sometimes it is not clear whether indications, measurement instruments, controls, and methods are appropriate, and we are far away from the real world treatment. These are basically because we can see that in placebo controlled trials, where we are giving patients placebo, sometimes it is ethical, sometimes it is not ethical, and we have to see all the aspects of the study which we are going to conduct. And if we are prescribing on a specific remedy, it may not be applicable to the patient and the results are still not good. And if we are prescribing on a RCT on a individualized homeopathy, then we have a better solution. So solutions for these are improvement of infrastructure and clearer research strategy, more exchange between research groups and more interdisciplinary cooperation. Pragmatic RCTs in usual care are to be conducted, and systematic work on proven indications. Multi-center studies and large sample sizes more comparison with standard therapy or usual care. In small sample size studies, use of validated outcomes instruments previously shown to be sensitive to change the reliability of the patient population within the subjects is the need to be conducted, because nowadays it is very important for integration, and the diseases where allopathic or conventional treatment is having a limited scope, because every pathy has its limitations and every pathy has to accept their limitations, and where limitation is there in conventional treatment, we can integrate with them by approaching them, collaborating with them. And this is the national health policy also, in where it is mentioned to integrate with another disciplines, and while integrating we can have the add-on treatment in one arm, and in another arm we can have the in the conventional treatment, where the results of the study can be seen effectively. Now, this is another observational study, effect of adjuvant homeopathy with usual care in management of thrombocytopenia due to dengue, a comparative cohort study. This study was also conducted by CCRH, where it was seen that very good effective results were seen by giving adjuvant homeopathy to the patients where the plasma, where the platelets count was even less, up to 10 to 20,000, and within one night only they were raised to 20 to 50,000 by giving homeopathic treatment. And even sometimes the MS of the hospital used to tell us that you take this case and then we will see the results in the morning. And effective results were seen, and they really acknowledged that the homeopathy medicine is effective. But this was an observational study done at that time in the cases of dengue fever, and randomized controlled trials may be conducted to obtain more insight into the comparative effectiveness of this integrative approach. This was the homeopathy study which has been conducted with Brazilian service sector company. The incidence in the COVID-19 patients. This was a preventive study. Incidence of COVID-19 was significantly lower among on-premises employees who received the generis epidemicus medication in comparison to the workers who did not receive the intervention. This was the feasibility of homeopathic treatment for symptoms reduction in an integrative oncology service, where it was seen that homeopathy can be successfully incorporated within a supportive care integrative oncology service. Another study of management in the patients of anxiety with depressive disorder, depressive episodes, patients management of anxiety with depressive disorders, patients aged more than 65 years, appears to have a real public health interest in terms of effectiveness and lower psychotropic drug use. Then in the basic problem with observational and cohort studies, because these are long term, having long follow-ups also, the lack of funds. And here we can see the biasness of our results is maximum seen. And the solution to this is launch fundraising efforts through non-profit organization on the internet for volume of smaller donations to support research, focus on large scale observation studies before investing in multi-center studies with RCT type designs, and try of comparative effectiveness studies, that is quasi-experimental studies. Then coming to the last part of the evidence-based studies is the case reports. Though the case reports are very important part of the study because they give the clue to conduct the proper research study. These are the real-time case reports which have been treated in the patients in the clinics of the each and every practitioner. But at the same time, we see that very hardly few practitioners are going for publication of such type of cases. And those who are publishing, there are no fixed pattern of reporting in terms of selection of follow-up, in terms of selection of the investigations which are to be conducted to the patient at baseline and during follow-ups and at the end of the treatment. And documenting the evidences is very much inadequate. And the validity of information from case histories is not self-evident. Use of guidelines particular guidelines which have been international guidelines like home care guidelines will contribute to transparent and accurate reporting and can significantly improve the quality and reliability of clinical case reports in homeopathy. Reproducibility is also very important in these type of cases, because the clinicians who are treating the case, it may be a rare case, then it has to be presented as a single, but sometimes it is being presented at 7 cases, 8 cases, 11 cases, 13 cases in a form of case series. There we have to see that if one particular medicine is effective, they should try to replicate the same medicine if the same medicine is effective or the individualization is working upon. So that should also be covered in the case series report when they are being published. And particularly use of the guidelines is very important to present the study. As we have seen in most of the conclusion, in most of the studies, it is based on study design, further limitations. Our findings should be considered cautiously. Further research is needed to overcome limitations of the study and to confirm our findings. Rigorous trials and independent applications are recommended to arrive at a confirmatory conclusion. These are generally the conclusion at most of the studies but while conducting the studies, literature view is very important, and we can see how we can, by adopting the proper methodology, how we can overcome these deficiencies. Coming to the strengths of homeopathy, we have strengths in mental disorders, geriatric disorders, diseases where modern medicine is not having any cure, surgical diseases to avoid surgery, thereby reducing both sufferings of patients and cost of treatment, using in terminal cases as adjuvant to conventional treatment, homeopath selection of medicine closest to real life practice. And coming to the weaknesses of homeopathy, it is based upon individualization, therefore no specific treatment can be given, no standardized prescription is there, selection of medicine for conducting research in a particular disease is not there to evolve the efficacy of homeopathic medicines which are already well proved. This is how we differ with conventional medicine, as we are not conducting clinical research on new drugs. Double-blind studies without considering the individualization according to homeopathic principles. And if we know the name of medicine, then whether it is true double-blind, since according to conventional system, it is not as prescriber as is at least aware of the name of the medicine. Homeopath selection of medicine plays an important role in this method. It is difficult to reproduce, because the person who is given one medicine and one particular on particular group of indications may not be available in the another patient. So replicability is not possible. So opportunities are, we are having a good number of practitioners for contributing the research. Institutionalization of homeopathy with government patronage is as in India and other countries. Boosting research at undergraduate and postgraduate level, funding for research, guidelines to follow the good and to conduct good research. Then the threats are less research literacy is there, lack of like-minded people to work as a team, need of good and innovative research questions with feasibility, different schools of homeopathy, use of combinations, multiple prescriptions and one time, and frequent repetitions in chronic diseases. Classical versus homeopathy practice and difference of opinion among practitioners, being the artistic homeopathy in being the artistic in nature. So to have a proper guidelines, we should use the finer formula. That is, while conducting any research, it should be feasible. That means required number of subjects should be there. Instruments, equipment, supplies, and other requirements to undertake the research should be available. Expertise should be there. Resources should be available. And objectives should be not too many and not too ambitious. And then with interest, topic should be interested to investigator as well as to the scientific community, because if we are taking a funding money on an area which is a very rare disease, it will not be of interest to scientific community as well as to the and as well as it will be the wastage of the funds. Then novelty should be there to contribute new information. Will it add to existing body of knowledge? Addition to previous studies may be confirmatory, contradictory, or extend previous findings. And ethics, it is very important that the studies should be ethically correct and consent of the patients has to be obtained. If we are conducting new therapy, conducting study on new therapy, the adequate data should be available by the animal studies and studies on a small number of human beings to confirm safety and suggest effectiveness of this. And there should not be any conflict of interest with social, cultural, moral, and religious and legal values. And research on animals should also be justified, and it should be relevant, must be potential to advance scientific clinical methods and health policy or good further guide further research. Besides the finer criteria, an imperfect consensus with enduring issues for clinical trials to be morally acceptable, a consensus exists that must be met by the following conditions. The study is important, patients of their representative give informed consent, and they have the right to withdraw, and physicians and investigators place the well-being of patients ahead of research interest. The study had gained an appropriate.
Sorry for the interruption, ma'am. With all due respect, we are running short of time, and I would request you to please wrap up in the next minute. Thank you.
Okay, thank you so much. A data safety monitoring panel should be there, and at the same time, aims of study are equally good. And these are the other issues, challenges which are facing while conducting the RCTs, various schools of thoughts, repertorial tools which I've already discussed, dose, potency, second prescription. What is there? These challenges are to be overcome while conducting the RCTs. And research challenges, we can see demonstration of similarium principle, then scientific plausibility of miasm, placebo effects, choosing right remedy, and from medicine point of view, accurate dose, perfect potency, method of preparation. And these are the various research challenges which we are facing. Lack of interdisciplinary exposure to work done by other scientists, and networking of research literature is more important, that lack of interaction between faculty researchers on some common topics. Summary of the biases is also there are types of biases: selection bias, information bias, confounding factors are there, and study factor is mixed with extraneous variables. The future research should be in the terms of pragmatic RCT in usual care, studies which are difficult to treat in conventional medicines, long-term follow-up with chronic disease to assess the recurrence, and replication of studies which have already been conducted. These are the guidelines which are already available on the website, and you can have the free access of these guidelines for conducting the research, writing the publication. And the need of the hour is to build the scientific evidences in support of homeopathy and to publish the results, because everybody is treating so many cases, even nowadays, with evidence-based with investigations, but they are not going for publications, or even if they are going for publications, they are not in a right manner how to get published, and therefore they should publish the results and to build research aptitudes in teachers as well as the students in the colleges. Thank you for your giving me the opportunity for this. This was a very large topic, and I have concised in a very short manner, and you can go to the given you all a lot of homework also for going through all the guidelines which I have mentioned in my presentation. Thank you so much.
Thank you so much, ma'am. Actually, it was a very insightful presentation. Maybe okay, so right now we don't have any questions, so maybe like at the end of all 4 presentations, we might have a few questions. Okay, then we can try to answer all those questions. So meanwhile, okay, so can we just go ahead with our next presentation? So now, okay, so the next presentation would be from Dr. Ronko Itamura from Japan, who will be talking on homeopathy for Parkinson's disease patients. Okay, so Dr. Ronko Itamura, so he is Vice President of Japan Liga, this is LMHI chapter, who is a Director and Fellow of the Japanese Society for Integrative Medicine, and who is a specialist in psychosomatic medicine and Morita therapy. So today, so he will be speaking on homeopathy can be used in the treatment of Parkinson's disease. So how to improve the quality of life using homeopathy with holistic approach. So let's hear from Dr. Ronco, so his experiences in treating patients suffering from Parkinson's disease and how to improve the quality of life using holistic approach with homeopathic treatment. So may we please welcome Dr. Ronco from Japan.
Thank you so much. Can you hear my voice? That's okay?
Yes, that's absolutely
Okay.
fine.
Can I start? It is a great pleasure for me to talk about my long history cases. And I would like to present how to contribute of homeopathy as complementary support for Parkinson's disease patient. This is my biography already, as the chairman said. I have been practiced as a homeopathy doctor in Tokyo since 2004. In my clinic, also 94% of our patients have actually already received conventional treatment. They are still experiencing difficulty in everyday life, so come to our clinic hoping for homeopathic treatment. When I use homeopathy for chronic disease patients who have been treated with conventional treatment already, I think it is very important to assess the progress of these patients after that homeopathy. So I use the three-step indication of recovery from chronic disease through homeopathy. This slide shows the three-step indication. The first step is to reduce difficulty in everyday life. It means increase quality of life, QOL. The second step is to reduce or stop conventional medicine. The last step is to reduce or stop taking homeopathic medicine remedies. I have been presenting integrative process using these three-step indication of recovery already for depression and intellectual mental illness. Now, I will present the process of homeopathic support for Parkinson's disease. Parkinson's disease, I will call PD, is a progressive nervous system disorder that's affecting the basal ganglia in the brain. The function of the basal ganglia is to balance and control the body's movement. PD can be cured. Treated of PD as symptomatic and frequent consist of complicated medicine regimen. This negatively influences therapy adherence, resulting in low benefit of treatment, drug-related problems, and decreased quality of life. The incidence of PD is 1 to 2% of people older than 60 years of age, affecting approximately 7.5 million of worldwide, up to more than 9 million in 2030. In Japan, an estimated 160,000 suffered. Some people, PD patients, seek calm therapies because having a low quality of life. This slide shows the Parkinson's disease symptoms. Four main symptoms: tremor, bradykinesia, rigidity, postural instability. Early in the corridor with the PD, the most obvious symptoms are movement-related, including shaking, rigidity, slow of movement, and difficulty with walking and giant. Later stage, cognitive and behavior problems may arise with dementia, commonly occurring in the advanced stage of the disease. Other symptoms of PD, including sleep and emotional problems, especially depression, difficulty in coordinating and speech, severe fatigue problem with balance and pain will have an impact on the patient quality of life. Slide of progression and QOL of PD. The late onset PD is associated with more rapid disease progression and cognitive decline, which may be related to a lack of compensatory strategy against cell death. PD was associated with an increased risk of dementia and increased risk of death. Drug treatment is the main treatment for its management. However, the effectiveness of long-term treatment is known to decrease, leading to end of dose deterioration, fluctuation in meditation response and side effect. Lower benefit of this treatment, drug-related problems and decreased quality of life. Quality of life decreased in PD and is linking with especially depression and emotional problem anxiety. The average of life expectancy following diagnosis is between 7 and 15 years, but the last stage of almost patient in bed. This here I will present the two patients who had maintenance better QOL first step for a long time through homeopathy. I pick up the rubrics of PD symptoms and some symptoms, especially make space or the suffering short stepping giant, as rubrics is face vacant expression of the face stiffness and the shaking, trembling as a leg. After picking up of rubrics and repertorization analyze, this repertorization supplied some remedies, phosphosphoradona or the Arsenicum vomica. Yeah, so this slide shows the various homeopathic strategy according to patient level of pathological flux. Strategy were used that included the holistic approach based on totality or the method of complexity, especially for the chronic or interactive case who had personal conflict, which were deep and hidden, and reaches the psychological as the problem is the subconscious level. Now, I will present the two patients. As for first case is a 79-year-old female. Her problem onset 5 years ago and treated with already 2 medicines, levodopa and cabergoline as for PD. She had right leg tremor and she short stepping giant. Her hand trembling is so severe, so she cannot write. And she complained of fatigue and chest distress. Her symptoms worst at about 5 p.m. in the evening. 5 p.m. Her nose is stuffy. The slide shows a homeopathic history, and she complained chilly very much, and especially cold weather is her symptom aggravated. So, can you hear?
ओके ओके हनी
Here.
ना बहुत सामने करती हूँ बताती हूँ ओके
Okay. Third, she craves water very much, and her nose is stuffiness, and she complained severe anxiety, and she had oppression. Her mental state is she is a very impatient person and restless. She is a very fastidious person too. She cleans up when she feels good and whenever she wants to do. She said, I don't like the garbage liking around there. It's easy to get tired. Recently, I'm very frustrated because I cannot move freely. After repatriation, some rubrics, I decided to async album. First consultation async album 30C 1 pills per day. 1 month after treatment, she said I was feeling better by the next day and my chest pain is gone. After 3 days, her feet had no shaking. After a week, the fidgeting in her foot decreased greatly. If she did anything before, she felt tired, but now she feels good and isn't tired even when she is doing something. Her legs are light. Her foot movement has recovered over 80%. It is amazing. She can work as differently before. 2 months after treatment, she feels much better. She can write. She cannot write before the homeopathic treatment. She forgets her symptoms. 3 months after treatment, when I noticed I broken down, the tip of my shoes was immediately broken, but now it's different. Her doctor has told her, you work a lot. About 4 years after treatment, she is already 83 years old. Her expression has become deeper. She liked to read books. She said, I can do this because of homeopathy. Her doctor said her tooth, your Parkinson has a very slowly progress. Her hands are not shaking. About 6 years, 84 years and 10 years old, 10 years after being diagnosed with PD, her medication is a lot of added to medicine. Not a lot, as only she meditated by 4 medicine for PD. And she said, I haven't caught a cold for years. My blood pressure is stable and I have appetite. I don't get sick. She said, I don't get sick. About 86 years old, she has a nose condition when she climbs. Nose symptoms get worse when she gets red in her cheeks. So I repatriated and another homeopathic medicine. And decided chamomile, 30C 1 pill a day. I prescribed the async album plus chamomile. Her hot flush disappeared after 1 month. About 9.5 years, dramatically improved after taking chamomile. Nose symptom disappeared. A neighbor said, you are very well. She keeps her good quality of life. About 11 years after treatment, she already 89 years old. 15 years after being diagnosed with Parkinson's disease, she feels better and mentally more calm than usual. This photograph is she came to my clinic. She is always as smiling, very good face. About 11.5 years after treatment, she died of aspiration pneumonia. Case 2 is a 68-year-old man, has onset 4 years and 2 years diagnosed PD, but he don't want to take medicine for PD and got treated with acupuncture and herbal medicine. But his Parkinson's symptoms gradually worse and complaint giant disturbs right hand tremor and muscle rigidity and depression. That is very important depression symptom is for him. And he is medication only as a hypertension medication. First history of diabetes and his family has a cancer history. And this slide is the homeopathic history for him. And he is a tree person too, and the weather is worse in cold, and he has a lot of perspiration, especially at night, and thirsty, very thirsty. Localization is he had a very chronic constipation, and urination is several times. He wake up at 5 a.m. by urination. He had a lot of dream. He had a strong mom. He had a very persistent man too. He has a very strong sense of justice and of angry at the news. He had a strong feeling of what should be, and he has a duality that is frustration in the heart, but to keep it hidden. He doesn't want to show people, especially weakness. His main problem is, I think, is depression. He said, I'm impatient and I don't feel things are going properly. My condition getting worse and I'm still depressed. And he said too, I worked at a machine technology company for 30 years after graduating from university. I have a strong sense of responsibility as a company and worked as the reliable boss. This shows as a depression scale as a psychological test. His score as 62, a score of 50 as the depression, especially this 62 indicated the moderate depression. After repatriation, I decided it's a loose talks. Loose talk 12C every day, 4 months after treatment. I can't write letter and my depression had disappeared 4 months after treatment. His depression has disappeared. His big shake became a small shake. The light of his body gets stiff when worked. 7 months, his thinking is very hard, but he became a soft thinking. He accepted the use of anti-Parkinson aided drugs, one drug. And I decided the loose talks at 30C per day. About 1 year after treatment, he is 69 years. My state of mind is good, and that is good for my whole body. I always enjoy myself. I prescribe loose talks 20C per day. About 3 years, he was 71 years old. He said, I can work amazing well. My doctor told me that the medicine for PD is kept in the minimum amount. That's a very, very small amount. And after 4 years after treatment, it's a lot better. I can wear shoes. My feet are normal. The doctor said that I was doing pretty well. About 5 years, he is 74 years. I don't like the symptoms. About 5 years and a half years after treatment, he died. And because at 3 months after being diagnosed with pancreatic cancer, he worked well and maintained QOL unit until his death. This photograph is the last consultation. Always he is smiling like the first case. But before the homeopathic consultation, he complained depression. So his face and his phenomenon is very bad. Conclusion: homeopathy for 2% disease patient, late onset, over an extended period of time. Case 1 was diagnosed with PD and died 15 years later at the age of 89, 11 years after starting homeopathy. Case 2 was diagnosed with PD and died of pancreatic cancer 7 years later and 5 years after starting homeopathy. The both had good quality of life until they died. Homeopathy can be useful, very useful for maintaining QOL as an integrated medical treatment for patients with Parkinson's disease, which is a progressive disease. Thank you very much for your attention. I'm sorry as the background is very noisy. Thank you.
Thank you so much, ma'am, for a wonderful presentation. Again, here, like, if there are any questions, so that we can wait until the end, so that we can answer at the end of our complete session. Okay, ma'am. Okay, so I think so we can go ahead with our next presentation now. Okay, so our third speaker for this session today. Okay, so would be Prof. Aaron from China. So Prof. Aaron.
Should I share my screen now?
Hello. Yes,
Yeah.
you can, please. Yes, please. Yeah, sure.
Are we audible?
Yes. Okay.
And
Okay, so I'm
can
just I'm just just introducing. Just give me just a minute, just few seconds. Okay, Prof. Okay, so Prof. Aaron, so who is the president of Hong Kong Association of Homeopathy, also a president of Macau Association of Homeopathy, and so he's holding like various positions. Who is also an associate editor for Indian Journal of Research in Homeopathy. Okay, so who is run by CCRH, Central Council for Research in Homeopathy. He has established homeopathic centers, Living Homeopathy in Hong Kong and Macau as well, and who has been an instrumental in translating Ken's repertory and William's Warwick repertory and Mathematica into Chinese language. So today, so he will be sharing his experiences in dealing with the cases of hepatitis B virus infection and its treatment using homeopathic remedies. So please welcome Prof. Aaron from Hong Kong to share his experiences and his knowledge in treating chronic hepatitis B patients with homeopathic medicines. Thank you so much, sir. Platform is yours.
首先咧，好多謝大會俾個機會我哋咧喺度發表我哋嘅資料。
First, would like to thank our organizers to organize such a nice conference.
嗱，我哋今日咧嘅主題咧就係主要係講咧香港嘅慢性乙肝患者咧喺個人化順勢療法治之後嗰個抗原嗰個血清轉化。
So our topic today is a case series of hepatitis B surface antigen seroconversion after individualized homeopathic treatment.
嗱咁乙型肝炎咧喺香港好常見嘅。
Chronic hepatitis B is really common in Hong Kong.
大多數東南亞國家咧帶菌比率咧係約莫係10至15%。
Most South Asian countries would have a carrier rate of 10 to 15%.
流行病學嘅研究估計咧，香港目前咧就係約莫乙肝嗰個感染率係7.2%嘅。
And studies has gauged like a prevalence of 7.2% for HPV infection in Hong Kong.
咁即係有54萬個慢性嘅乙肝嘅病毒個案嘅患者嘅。
That means we got 540,000 HPV cases in Hong Kong.
咁有幾個因素咧係影響住咧乙肝嗰個自然嘅感染嘅，即係自然嘅感染嘅。
And there are several factors that would influence the natural history of the HPV infection.
咁包括係獲得嘅年齡啦、病毒嘅特徵啦、宿主嘅因素啦，同埋呢啲外源性嘅因素嚟飲酒啦咁樣。
Including the age when the infection is acquired, viral characteristics, host factor, and exogenous factors like whether they consume alcohol regularly.
OK。OK， 嗱咁咧，佢哋咧係可以咧係由完全係冇症狀啦，到去到咧可以去到末期嘅肝硬化啦同埋肝癌嘅。
It can have present if you have a wide spectrum from asymptomatic, no symptom at all, to end-stage cirrhosis.
好啦，我哋咧係可以講譬如唔同類型嘅乙肝炎患者啦，
We can talk about three types of chronic hepatitis B patients.
一啲非活躍嘅帶菌者，
Inactive HBs antigen carrier.
佢主要咧就係個 DNA 檢測係冇啦，或者非常之低啦，同埋咧冇症狀嘅。
In this group, they are mainly asymptomatic. They got no or undetectable HBV DNA and normal ALT.
但係呢個咧係一個最大嘅群體，而且咧係佢哋冇常規治療嘅。
This is by far the largest group, and there is no conventional treatment in this group.
OK， 咁嗱，我哋喺跟進嘅期間咧，咁呢啲處於非活躍嘅帶菌者咧，佢有20至30% 咧係可以咧係變得係活躍嘅喎。
However, during follow-up, 20 to 30% of this group of patients would undergo spontaneous reactivation.
喺多次變得活躍啦，或者持續活躍之後咧，係可以咧係變成一個進行性嘅肝損傷同埋肝衰竭嘅。
Multiple episodes of reactivations or sustained reactivation can cause progressive hepatic damage.
咁我哋跟進嘅結果咧，希望就見到血清嘅轉化啦。
And then the main principal outcome is seroconversion.
OK， 好啦，點樣為之叫做血清轉化咧？就係譬如由呢個 S 嘅抗原啦，能夠轉變為陰性啦，同埋咧佢產生到抗體嘅。
And so what we mean by seroconversion is to become the antigen negative and the positive, developing positive anti-HBs.
嗱咁咧就係屬於一個康復性嘅，即係康復咗嘅乙肝啦嘅個案啦。
It signifies that their hepatitis B is resolved.
但係呢啲係非常之罕見嘅，但係咧佢預後係有改善嘅。
And this is a very rare case, but in this, if the seroconversion did happen, then the prognosis improves.
嗱咁好啦，咁我哋就講下啦。譬如活躍嗰啲啦 ，OK， 即係活躍嘅慢性肝炎啦。咁我哋睇睇個血可以檢測到佢血清嗰個水平嘅 DNA 咧係高嘅。
And another group is the active chronic hepatitis group of patients. They would have detectable HBV DNA.
ALT 咧水平亦都係高嘅。
And they would have high ALT.
有肝壞死嘅組織啦。
There may be hepatic necron inflammation on histology.
嗰個肝嘅損傷嘅程度咧，可以係輕度啦、中度啦，甚至係重度嘅。
The liver damage can range from mild, moderate to severe.
好啦，佢哋一般嘅常規嘅治療啦，就係譬如抗病毒嘅藥物啦，你見到好多種啦。咁另外干擾素嘅注射啦，同埋肝移植啦。
The conventional treatment would include antiviral drugs, interferon, or liver transplant.
咁但係咧，佢哋主要嘅問題係咩咧？就係當停止治療之後咧，好多時都係復發嘅。
However, the main challenges would be when the treatment stop, then relapses are so common.
咁而且咧係內藥嘅突變咧，亦都經常出現啦。
And also the emergence of drug-resistant mutant.
好啦，咁我哋咧係講一講一啲個案啦。
So we would share our cases.
咁第一個個案啦，
In the first case,
64歲一個中國女性啦。
a 64-year-old female.
佢由2014年11月開始使用順勢療法嘅。
She started homeopathy in November 2014.
佢係一個慢性嘅帶菌啦。OK， OK 得。嗰個慢性嘅乙肝帶菌啦，同埋咧係伴隨住肝硬化。
And they got chronic and there is chronic inflammation with moderate to severe liver fibrosis.
OK， 好啦，佢咧就係20年前咧已經篩查確診咗㗎啦。
She was screened positive more than 20 years ago.
但係近3年以嚟咧，佢嗰個 DNA 嗰個指數係一路上升嘅。
But in recent 3 years, the HBV DNA climbed up.
好啦，佢喺2007年嘅時候咧已經超過，即係個指數已經超過咗2萬㗎咯。
And in 2007, the DNA is already higher than 20,000.
咁佢當時一開始係中醫治療，就拒絕咗咧係嗰個西醫嘅抗病毒治療。
At that time, she started a traditional Chinese medicine treatment, and she rejected antiviral treatment.
咁我哋睇到佢2011年嘅時候咧，的而且確指數係下降，去到700幾。
You can see that in 2011, the copies of DNA obviously decreased.
咁但係到去到2012年嘅時候咧，就開始有反覆上翻6000幾，去到2013年嘅時候又落翻3000幾，持續之後咧就6000、3000咁樣嘅。
However, afterwards, in the next few years, it rises up again and it fluctuates between 3,000 to 6,000.
咁所以咧喺佢2014年11月咧就開始順勢嚟發就停止咗中醫啦。
And that's why in 2014, she switched to homeopathy and stopped TCM.
OK， 好啦，咁喺2014年11月嘅時候咧，佢喺開始順勢嚟發之前咧，佢已經有中度至重度嘅肝纖維化啦。
And before she started homeopathy, she was found to have moderate to severe liver fibrosis.
佢肝酵素正常嘅 AFP 都係正常。
At that time, the liver enzyme was normal and AFP was normal.
但係咧，佢咧就發現自己嗰個DNA 個檢測個數字咧，如果係高嘅話咧，咁佢個持續嗰個水樣大便亦都係多嘅。
But she found that when there is a high HBV DNA, then her persistent loose watery stool was also more severe.
但係中醫初步改善嘅時候咧，嗰個稀嘅大便咧同時改善嘅喎。
During the initial improvement with TCM, the watery stool also improves.
但係咧，自從2011年起開始嗰個肝炎嗰個情況反覆復發嘅時候咧，咁佢個稀嘅大便咧同時一樣咧係同步都係差咗嘅。
However, when the situation kind of relapsed, these symptoms of watery stool relapse also.
好啦，咁而咧佢有其他嘅症狀嘅，咁大多數都係更年期之後就出現嘅。
She also got other symptoms, include many of the symptoms are actually since the menopause.
例如咧，佢嘅脾氣暴躁啦，
like her quick temper.
佢好容易一激動嘅時候面都紅晒啦。
When she gets excited or angry, there is hot flashes.
例如當佢打麻雀嘅時候，佢有陣時會壓抑自己嘅情緒㗎嘛，佢頭部充晒血啦，跟住咧就哇個頭好似變大晒咁樣，跟住咧好似就爆炸咁樣。
She said when she needed to suppress her emotion during playing mahjong, then the whole head feel like congested, enlarged, and about to explode.
咁佢咧有右邊嘅太陽穴咧，佢有呢個慢性嘅疼痛嘅。
And there is chronic pain at the right temporal area.
呢個咧係由佢鬆動咗嗰個大牙咧就散射出去。
This is the pain that radiates from the loose molar teeth.
嗰種痛咧有斷斷續續嘅搏動痛嘅。
And the quality of pain is pulsating.
而且經常咧係有復發嘅脷嘅潰瘍咧，非常之疼痛咧，仲有係稀嘅大便嘅。
And there is also recurrent ulcer on the tongue and loose stool.
好啦，而佢大部分嗰啲症狀咧都係通常由食一啲辣嘢開始而加重嘅。
And her other symptoms include generally aggravated from spicy food.
復發性嘅尿道炎咧，一年起碼都有2次㗎，多年以嚟都係咁。
And she got many years of history of recurrent UTI. She has more than 2 attacks every year.
咁再左骨神經痛啊，右邊係比左邊嚴重嘅，寒冷而加重。
And she also got severe sciatica, and right side is more than the left side and aggravated from cold.
好啦，咁我哋就將頭先剛才講嘅症狀咧，冚唪唥放晒落去咧嗰個 repertory 嘅計分板入邊啦。
And then we put them all into the repertorization.
係啦，好啦，咁咧我哋經過鑑別性嘅分析之後咧，佢喺佢生命入邊呢啲幾個重要嘅點上邊咧，都出現咗啲茄科植物嘅表現㗎。於是咧，我哋就處方咧CAPS 嘅30C 嘅。
After differential diagnosis with some Solanaceae expression at a few important points in her life, capsicum was prescribed.
咁咧就每2至4個星期咧先重複一次，原因因為咧佢係會一重複佢會經歷一啲即係牙痛嘅嚴重惡化嘅，咁嗰個牙痛會散射到去頭部啊。咁但係咧好有趣嘅地方就係同時咧佢嗰個暴躁嘅脾氣咧喺度同時減輕緊。
It was prescribed at once every 2 to 4 weeks at the very beginning because there is severe aggravation of the tooth pain, which radiates to the head. And at the same time, actually the quick temper was getting less.
OK， 好啦，咁然後咧喺跟住落嚟嘅年半裏邊咧，佢嘅焦慮啦同埋脾氣咧有咗好大嘅改善嘅。
And then in the 1.5 year afterwards, her anxiety and temper improved significantly.
坐骨神經痛亦都有咗顯著改善啦，但係佢嗰個潮紅啦、充血性嘅頭痛咧、稀便啦、散射到頭部嘅牙痛咧，一直係時好時壞嘅，而血壓都有上升嘅趨勢140啊、150啊咁樣嘅。
And also her sciatica also improved, but her hot flash, congestive headache, loose stool, tooth pain, etc. are still on and off, and her blood pressure was also on the rising trend.
但係咧，我哋見到咧，佢 DNA 咧由呢個14年嘅4月咧6000去到2016年3月嘅440嘅。
However, when we check the blood, then we can see the DNA fall from 6,000 to 440.
OK， 咁喺呢個時候咧，我哋就將個 CAPS 30C 升為200C 啦。
And at this moment, we upgrade the 30C to 200C.
OK， 好啦，咁喺2017年嘅3月咧，喺發現啲臨床嘅症狀喺過去嘅12個月裏邊咧，係變化都唔大嘅。
And then in March 2017, we find that in the past 12 months, there is no significant change in the clinical symptoms.
咁喺2017年嘅5月咧，係見到個 DNA 檢測都冇乜大變化嘅。
And then in May, in the blood test, it is also static for the DNA.
咁喺呢個時候咧，我哋咧就將個摩根 B30C 咧就係加入去佢嗰個處方入邊啦，就係12個鐘頭咧就一次，就1個星期咧就做一次，就連續食3劑，咁就同佢嘅體質療劑同時進行，不過體質療劑必要嘅時候先服用。
Then at this moment, we add an intercurrent remedy, which is a bionosal of Morgan bark, and it was taken at 30C 12 hourly times 3 every week. And then intercurrent with her constitutional remedy, and the constitutional remedy is just taken when necessary.
OK， 好啦，咁去到2018年嘅2月啦，佢個潮熱啦、充血性頭痛啦、牙痛啦、脷嘅潰瘍啦，同埋血壓都有所改善。咁而咧30% 嘅時間呢個大便係成型嘅，剩翻70% 時間仍然係水樣嘅。
And another year, after another year, the hot flashes, congestive headache, tooth pain, tongue ulcer, blood pressure, all of these symptoms improved. And the stool also improved. 30% of the time it is in shape, but there are still 70% of the time that is watery.
嗱，佢今年咧就冇檢查 DNA 啦，咁我哋咧就係同時我哋咧就將個 HB 嘅 nosal 30C， 咁就係每12個鐘頭3次，就每兩個星期1次啦。就另外咧就係呢個摩根 B 嘅30C 咧，都係12個鐘頭1次，3次咧，咁就交替嘅。
She didn't check the DNA this year. However, at this moment, we add the HB nosal 30C into her regimen. And the method is to alternate with the Morgan B30C in alternate weekly. And the constitutional remedy is just taken when in need.
咁呢兩隻療劑交替之外咧，佢體質療劑咧就係有需要嘅時候服用嘅。
The constitutional remedy is just taken when necessary.
好啦，咁去到2019年嘅2月啦，咁咧佢現在嗰個稀便情況大改善啦，大便咧大部分嘅時間都係正常嘅。
And then after another year, the bowel opening is now much improved, and the stool now is in shape in majority of the time.
咁去到2019年嘅1月咧，個 DNA 嘅檢測咧係已經去到低過10，即係檢測唔到㗎啦。
And at this time, when she checked the blood, there's no more detectable DNA.
咁喺掃描嘅時候咧，佢哋發現咧係只有輕微咧，甚至係冇肝纖維化啦。
And the fibroscan at that time also showed none or minimal liver fibrosis now.
咁嗰個乙肝嘅 S 嘅抗原咧係呈陰性嘅，而 S 嗰個抗體呈陽性㗎啦。
The HBs antigen now become negative, and she also developed positive antibody towards the surface antigen.
咁喺2021年嘅覆診入邊咧，患者整體嘅情況都係良好嘅。
And then she's followed up till now, and she's generally well.
咁我哋咧可以睇下咧呢個Monarch 嘅嗰個評分啊。
We can try to assess Monarch for this case.
咁我哋睇睇咧，佢嗰個處方咧係咪順勢療法主要有令到佢有主要改善啦？仲有咧係服用嘅療劑嘅同個症狀嘅改善係咪合理嘅時間啦？咁啊有冇出現初期嘅症狀加重咧？咁啊其他症狀最終係咪得到改善啦？咁另外咧係咪整體都有改善咧？喺呢5個問題咧，喺剛才我哋陳述入邊咧都係睇到係明顯有嘅。
The first 5 points are quite significant from the history that we have just reported, including the improvement of main symptoms, improvement of the clinical symptoms within a possible time frame, and there is an initial aggravation of symptoms, and the effect doesn't only cover the main symptoms, but it is in general, and there is an overall well-being improvement.
OK， 好啦，咁咧喺治療嘅方向上邊啦，咁係咪由仲要向次要走咧？咁我哋睇得到係嘅。咁點解咧？因為你見到嗰個患者咧，佢嘅由嗰個精神層面，佢嘅脾氣咧一路咧係走向嗰個肉體嘅。OK。
6B is about direction of cure. So is the patient following the direction of cure? Yes. At first, her emotion improves first, and then the symptoms is activated in the body.
譬如內向外走啦，譬如佢個肝嘅症狀一路改善啦，咁跟住咧個腸胃先係最有改善嘅。
And it is from the inward to out because it is the liver function that first improves, and then the bowel function follows.
OK， 好啦，咁有冇其他除咗療劑，有冇其他因素啊嚇 ？OK 可以引致嘅症狀改善咧，唔關療劑事咧咁樣。
And besides the remedy, are there any alternate reasons that can explain the improvement of her case?
嗱，咁其實我哋可以睇到嘅 ，OK 其實冇乜可能嘅，點解咧？因為喺呢個期間咧，個患者咧係冇接受過其他治療。
It is not quite likely because there's no other treatment during this period.
咁而且咧喺亞洲嘅地區啦，咁啊嗰個即係喺呢個地方係譬如自發嘅血清轉化咧，咁喺呢個咁樣亞洲嘅肝炎流行嘅地區咧係好罕見嘅。
And in Hong Kong is an endemic region for hepatitis B, and in our region, spontaneous kind of seroconversion is really rare.
咁而且對方即係嗰個患者亞洲人啦，咁而且咧喺一個DNA 嗰個水平比較高嘅病人入邊啦，嗰個 S 嘅抗原嗰個自發性轉變係更加罕見。
And spontaneous kind of antigen loss is especially rare, especially when the patient is an Asian and with a high baseline HBV DNA.
OK， 好啦，咁另外咧係咪有客觀嘅證據證實嗰個健康情況有改善啦？同埋咧係咪有即係重複療劑有冇係引起嘅改善咧？咁頭先喺剛才嘅陳述咧都係證明係事實嚟嘅。
And then the last 2 points of scoring, which is the health improvement confirmed by objective evidence? Yes, we got all the blood tests. And then did repeated dosing cause similar clinical improvement? Yes, that is why we prescribe our constitutional remedy when in need.
OK， 咁所以咧，我哋可以睇到咧 Monarch 嘅嗰個評分咧，係我哋得出一個咧係佢呢個病者同順勢快有個良好嘅因果關係。
And that is how we got the 10 out of 13 score from the Monarch, and it can indicate that their causality score is actually quite good.
OK， 好，咁我哋咧就講下另外一個個案啦。
Then we go into case 2.
咁呢個咧就係一個59歲嘅男性。
A 59-year-old male.
咁佢嚟揾順勢療法咧，主要原因因為佢嘅右膝頭痛啦、前列腺嘅肥大啦、有呢個睡眠窒息啦，同埋咧下身咧係呢個濕疹嘅。
His complaint when he came to us was actually the knee pain and then a prostatic hypertrophy, severe obstructive sleep apnea, and also eczema.
OK， 而且咧佢係一個冇症狀嘅乙肝帶菌嘅患者，超過20年㗎啦。
At the same time, he is an asymptomatic carrier for more than 20 years.
OK， 咁我哋咧就處方咗錳嘅30C。
We prescribed the magnesium 30C.
同埋咧 HB 嘅30C。
And HB also 30C.
每週交替。
Every alternate weekly.
咁喺8個月之後啦。
After 8 months.
佢嗰個S 嘅抗原呈陰性，抗體呈陽性。
The antigen became negative, and he also developed anti-happy surface antibody.
咁因為時間關係，我哋講唔到咁詳細啦，呢啲 case 啊。
Because of the time limitation, we are not going into this case really in detail.
咁但係咧喺接下來嘅2年裏邊咧，患者嘅睡眠窒息咧、前列腺同埋膝蓋嘅情況咧係一路持續改善嘅。
But then in the following 2 years, the patient continued to improve in his other symptoms of sleep apnea, prostatic symptoms, and also knee symptoms.
OK， 好啦，我哋講下第3個個案。
And then go into case 3.
咁一個58歲嘅女性，
58-year-old female.
佢嚟揾順勢療法咧，
She came to us
係因為有失眠啦、頭痛啦、便秘啦。
for insomnia, headache, and constipation.
咁佢都係一個冇症狀嘅乙肝帶菌者，就持續咧係20年㗎啦，就係多超過。
She's also a chronic carrier for more than 20 years, and she's also asymptomatic.
OK， 好，咁咧我哋就處方咗鐵啦，30C。
Her remedy was a ferrum metallicum.
1個星期2次。
We prescribe at wet dose twice per week.
咁喺此後嘅年半裏邊咧，佢嘅所有症狀咧係逐漸改善嘅。咁但係咧，佢嗰個 S 嘅抗原咧個狀態係冇改變嘅。
In the 18 months afterwards, all of her symptoms improved. However, the hepatitis B status did not change.
嗱，咁之後咧，我哋就加入 HB 嘅30C，就每週1次 ，OK 就交替啦。
And then we add the HB nasal 30C dry dose weekly.
好啦，咁1年後啦，佢個 S 嗰個抗原咧就從陽性咧就轉為弱陽性啦。
And then after 1 year, the HBs antigen changed from positive to weakly positive.
咁2年之後啦，
And then 2 more years,
咁嗰個 S 嘅抗原咧就呈陰性啦。
the HBs antigen was found to be negative.
但係個抗體水平咧仍然比較低，就尚未呈陽性嘅。
The anti-SHB is climbing up, but is still low and not yet positive.
咁我哋見到個案呢個血清轉化過程進行中嘅。
So we can see in this case there is a progress towards the seroconversion.
OK， 好，咁另一個值得思考嘅個案啊。
One more case which may deserve to be think about.
咁啊，呢個第4個個案啦，佢係咧一個活躍嘅慢性嘅乙肝大菌啦，佢伴隨住肝硬化同埋咧係個肝有結節嘅。
This is a case of active chronic HPV infection with cirrhotic changes with cirrhotic nodules.
咁喺呢個個案2020年啦，一位男性57歲。
In 2020, he came to us at a 57-year-old.
咁佢咧呢個病者咧有強烈嘅嗰個叫做乙肝帶菌同埋呢個強烈嘅肝癌嘅家族史嘅。
He got a strong family history of HPV carrier and also hepatocellular carcinoma.
咁喺2019年尾咧，咁啊發現咧佢先前唔活躍嘅乙肝咧嗰個感染咧就持續變得活躍喎。
In late 2019, it was found that his previously inactive infection turned to sustained reactivation.
咁個患者咧就喺2020年嘅6月起咧就接受咧呢個西醫嘅抗病毒治療。
And then in June 2020, he started to take the antiviral drug.
喺2個月之後啦，
But then after 2 months,
佢因為咧副作用好犀利，咁所以拒絕，即係佢繼續啦。
because of the side effects, he cannot tolerate it, so he stopped the antiviral
佢
medication.
然後咧就尋求咗順勢療法嘅幫助。
And then we start homeopathy.
OK，咁我哋咧就開出咗咧佢嘅體質療劑咧就係阿魏啦，30C， 1日4次。
So the prescription was asafoetida 30C 4 times daily.
咁到第2個星期咧，我哋就俾 HB Nosal 嘅30C， 每日4次。
For 1 week, and then the other week we changed to the hepatitis B dosal
每
30C.
每個星期交替啦。
And they were used alternatively.
咁佢個黃疸啦，同埋其他嘅症狀，包括茶色尿啊、水腫咁樣咧，就一並改善緊。
The jaundice improved along with other symptoms, include color, urine, and edema.
但與此同時咧，佢個頭皮啦同埋面部就出現啲出現啲疹啊，然後咧就全身都出現。
At the same time, there is some pimple-like eruption at the scalp and face, and then all over the body.
係啦，嗱咁我哋可以睇到咧呢個個案咧，佢由2020年嘅6月啦，咁就開始有抗病毒嘅治療啦，到8月嘅時候佢就停止啦，咁啊到。咁你見得到咧，嗰個之後咧，佢就一停止咧，就佢個指數反彈。
You can see he started the antiviral treatment in June, and then he stopped the antiviral medication in August, and then the DNA level rebound.
嚇，咁佢跟住之後咧就開始順勢療法啦。
And then he started homeopathy.
咁啊一路改善中。
And then you can see the blood test improves
好啦
gradually.
咁喺2020年8月咧，佢用順勢療法之前嘅超聲波檢查咧，係見得到咧有一個咧係有一個咧係4cm 嗰個4厘米嗰個結節同一個2厘米嘅結節嘅。
And before the homeopathy, in the scan, we can see there is 2 nodules. One is 4 cm and one is 2.2 cm, and it is a suspected cirrhotic nodule or hepatocellular carcinoma.
係啦，咁但係咧，去到2021年嘅5月咧，即係用咗9個月之後啦，個超聲波檢查啦。
And then after 9 months of treatment,
咁你就發現咧係冇咗嗰個腫塊個肝。
in the ultrasound scan, there's no more abnormal solid mass seen.
OK， 好啦，咁我哋可以得出一啲我哋討論嘅總結啦。
So we can come to our conclusion.
OK， 好啦，嗱。我哋剛才咧就簡單咁介紹咗4個慢性乙型肝炎患者嘅個案啦。
So just now we have finished 4 cases of hepatitis B chronic cases. We briefly show the process.
因為時間關係，我介紹4個啫。其實我哋經驗入邊仲有啲其他類似嘅個案嘅。
Because of the time limitation, we cannot go into too many details and too many cases.
係啦，嗱喺與單獨嘅體質治療相比啦。
But if we compare with constitutional treatment only,
睇落咧就似乎係體質治療再加 HB 嘅 Nosal 咧，似乎咧係有更好嘅反應。
it seems that if we add the HB Nosal into the constitutional treatment, it seems that patient will get better response.
咁喺血清轉化嘅自然過程入邊係罕見嘅，但係使用個人化順勢療法咧係有可能嘅。
Although seroconversion is rare, but it may be possible if we use individualized homeopathic treatment.
嗱，根據呢個克林定律嘅痊癒法則啦，咁我哋一路觀察住嗰個患者嘅精神啦、情緒啦、症狀呢個叫做局部症狀咧，咁似乎咧係 可以同呢個即係譬如冇症狀帶菌者咧，我哋可以睇得到咧，佢都係一個血清轉化過程咧，係一路進行中嘅。
As long as we monitor the patient according to the
कविता शर्मा कविता मनचंदा तो हो ही सकती है
the
तो ऐसा करता हूँ मैं कविता मनचंदा का आपको नंबर दे देता हूँ उसका ना सारा उसके अंदर है
I'm not muting them.
he's a registered one
Hello, in the yes, ma'am.
उसको लिंक भिजवा दो जूम वाला ना मतलब जिनको भी इन लेना है ना उनको जूम का लिंक भिजवा दो तो
when we monitor the patient according to the Haring's law, actually we can kind of expect that the seroconversion is in the same direction.
咁但係當然如果有檢測會更加好啦。
But of course, it would be much better if we can have a regular blood test so that we can follow up the progress.
嗱呢個可能咧，可能係喺幾個月裏面發生，但大多數咧都要啲幾年時間。
Seroconversion can happen in months. However, in many of the cases, it would take a few years.
OK， 好啦，咁啊，多謝各位嘅關注。
Thank you for your attention, and that is the end of our presentation.
再次感謝大會嘅給予嘅機會。
Thank you again, LMHI, for organizing such a exciting event.
Okay, thank you.
Thank
Okay.
you.
Thank you so much, Prof. Aaron, actually, for a wonderful presentation. Okay, so as usual, so we shall wait, okay, until our fourth speaker, okay, completes his presentation, and then later we can have question and answers session. Okay, thank you so much, Prof. Again. So we shall move, okay, ahead with the last presentation of this session, which will be by Professor Dr. Praful Barwalia sir from India. So who will be talking on effectiveness of homeopathic treatment in sensory processing disorders in autism, ADHD and learning disabilities. So Dr. Praful Barwalia sir, so who is actually a gold medalist in homeopathy and a founder chairman of Spandan organization, so which runs Spandan Holistic Mother and Child Care Hospital and Special School in Mumbai, India. So a well-known figure in the field of homeopathy, who has been a principal investigator in many projects, especially sponsored by Ayush, who has worked extensively in the field of thyroid disorders, autism, mood disorders, HIV, AIDS, etc., etc. So may we please welcome Barwalia sir to share his experiences in managing patients with sensory processing disorders with the use of homeopathic medicines. Thank you so much, sir, for being here. So the floor is yours. Thank you so much.
Thank you, Dr. Ibrahim. Thank you, Dr. Manchanda, all dignitaries and dear colleagues. It gives me immense pleasure to share my experiences with you all with this august gathering in this wonderful forum. I am grateful to LMHI for this magnificent event and giving me an opportunity to participate in it. Sensory processing disorder. Now, when we talk of senses, all our knowledge begins with the senses, proceeds then to the understanding and ends with reason. There is nothing higher than reason, says Immanuel Kant, German philosopher. So our journey begins with whatever we receive through our senses. And the early 24 months of life are extremely crucial in processing those sensory input, because that determines our entire future, how we are going to evolve, how an infant will become a toddler, and a toddler will become a child, and child will become an adolescent and adult. So those 24 years where the connectivities are getting established, the synapses are getting generated, extremely crucial phase. And these are the children, individuals who suffer from impairment of processing of the sensory input. Now, this has a lot of ramifications. When we see sensory processing disorder, it's a condition in which the sensory signals received by the CNS do not become organized into an appropriate response. So when the integration doesn't take place, obviously the response would be quite erratic, quite aberrant, unpredictable, and imbalanced. This is the overall map we know about how sensory integration takes place, the psychoneurophysiology. If I give you an analogy of sensory impairment, it's like driving a bad car. Imagine you're driving a car that isn't working well. When you step on the gas, the car sometimes lurches forward and sometimes doesn't respond. When you blow the horn, it sounds blaring. The brakes sometimes slow the car, but not always. The blinkers work occasionally, the steering is erratic, and the speedometer is inaccurate. You are engaged in a constant struggle to keep the car on the road, and it is difficult to concentrate on anything else. This is the plight of those children and adolescents who suffer from the sensory processing disorder. We see that it has an impact at various levels. Visual, auditory, kinesthetic, proprioceptive, vestibular, of course, all spatial senses. So there you see either hypersensitivity or hyposensitivity. Every time you tried to write with your pencil, it broke because you pushed too hard. You know, that sense of pressure, sense of touch. The different smells in the room made you utterly nauseous. The humming of the lights sounded louder than my voice. This is what patient presents. You couldn't focus your eyes on me because everything and everyone in the room catches your attention and your eyes just go there instead. So this is quite crucial, sensory integration. And when it is impaired, we will have a great impact and neurodevelopmental disabilities which come up, mainly autism spectrum disorder, specific learning difficulties like dyslexia, dysgraphia, ADHD. Now, in all these three disorders, you will see sensory processing disorder at a very core level. Of course, you will also see ODD, depression, ADD, as well as OCD and other developmental dysfunctions associated with sensory processing disorders. So our focus is we are trying to understand effectiveness of homeopathic therapeutics in the management of sensory processing disorders. And when we are talking of disorders like autism, disorders like ADHD, we are from homeopathic perspective, and more so because our theme today is the chronic disease management. We see from that perspective two major classes. One is a one-sided diseases. Number of children suffering from autism disorders will present you with myriad of symptoms which you put in a nosological zone and very few individualizing features. So it poses a great challenge. How do we perceive individualizing features? So one-sided disease, paucity of symptom, that becomes one class. Another class is you do see high-functioning autistic children or ADHD who give you number of peculiar characteristics, well-qualified features at the level of mind as well as at a physical general, and what is known as full-blown miasmatic evolution. So you get both the varieties. It's a spectrum disorders, and we have to identify where our patient lies. We have studied 234 cases of sensory processing disorder. 60 cases, it includes 60 cases of autism disorder registered, studied, and managed at Spandan under auspices of Ayush funded extramural research project from October 2006 to September 2007. 32 cases of autism where impact of homeopathy was studied in comparison with occupational therapy. Now, in fact, those 32 cases, we got reference from occupational therapists, our colleagues, as well as other special educators who were finding it very difficult to handle behavioral and serious sensory issues. And so since they had seen homeopathy working, they had referred, so we could have data of impact of occupational therapy on them. And then after intervention, what was happening. So 6 months on therapy and then subsequently on homeopathic medicines as well as therapy going on. What is the differential impact? Now, as usual, the stage 1, we have screening, detailed screening with comprehensive checklist, exclusion criteria, assessment by clinical psychologist, wherein you put the diagnosis, childhood autism disorder through DSM-4 and ICD-10, now of course DSM-5. This was long back. Now, we utilize internationally accepted scores, childhood autism rating scale, autism treatment evaluation checklist. Now, number of these children with severe ADHD as well as autism present with associated mental retardation, and then classical IQ becomes very difficult when they have either moderate or profound retardation, or they may have severe behavioral dysfunction. In those cases, we take SQ. Autistic hyperactivity score helped us to judge magnitude of hyperactivity. Comorbidity like epilepsy and other neurological difficulties may be associated. So accordingly, EEG, BERA, genetic evaluation, audiogram, and in recommended cases, MRI was taken up. While ATEC, every 3 months, we had carried out. Autistic hyperactivity score was done every 3 months, and remedy response comprehension form was filled, and that was quite useful. Now, I'll introduce you autism treatment evaluation checklist. How does that help in perceiving the sensory component as well as the behavioral component so well? Because this has 4 domain: communication, sociability, sensory, health, and behavior. And you have the score at each level. And so we are in a position to identify and understand very clearly, objectively, that how our remedies are working at all these planes. And depending on what is dominant in the case, we can very well appreciate that whether the case has strong behavioral disorder coming to kinetic zone, or a stereotype, moving monomaniac features, classical autistic hyperactivity, or regressive feature, which are available in number of cases. That is further classification from syndromic point of view. I will take up 2 illustrative cases and then go to the data again. Now, this 9-year-old Roman Catholic boy came to us in April 2007. Apparently normal milestone, used to call mama, dada, used to repeat rhymes, and then suddenly lost the speech. Regression 1.6 years. This is what happens in number of autistic children. They start life very well, but suddenly something happens and regression. Mother stopped vaccinating since then because she could very well correlate that exactly 3 weeks after the last dose of vaccination, the child had come down with regression. Diagnosed autistic in 2001 at 4 years of age. Poor eye contact, hyperactivity, self-destructive behavior. Now, a little bit family background: alcoholic father, and during pregnancy, she always felt that she was never taken care of, felt neglected, felt extremely depressed, insecure. And although now she admitted that my husband is caring, but during that phase, I don't know what happened to me, but I felt extremely deserted. And her sensitivity was quite accentuated. Mother state during pregnancy is quite important, and we evaluate in each and every case. Cesarean was done. Birth weight was 3 kg and child cried immediately after birth. Past history of chicken pox. Father alcoholic, maternal grandfather also alcoholic, renal failure, and maternal grandmother diabetes. Now, apart from this, we could see one peculiar feature: involuntary movements, flapping jaw, hands, legs repeatedly, constantly moving, jumping, bouncing, quite violent, self-destructive, biting self, striking his head against the wall, tearing things, throws things. All these things get aggravated because of the number of sensory processing dysfunction. Auditory issues, fear of noise, 3 marks, lightning, cooker whistle, crackers, closes ears and run away. Now, islets of ability, a very, very interesting aspect, and this also becomes quite a peculiar thing in homeopathic prescribing. Loves drawing and sketches. This is what you see in spectrum. You are seeing a lot of dysfunction, but you will see some islet. Now, can draw just from his memory, calms down if he gets to write, draw, almost goes into drawing frenzy, will go on writing, drawing, and recalls from the memory, will put down the graphic, will put down the faces. And so happened that once even the police had taken his help to draw the sketch of he had happened to see some burglar. Mild autism, 32 was the CARS, ATC 73, SQ 60, 65, while autistic hyperactivity score 52. Beta normal, EG normal, karyotype normal, serotonin 83.2. Quite restless, violent, self-injurious, mild retardation, recurrent upper respiratory tract infection, goes into frenzy for abstract drawing and sketches. And at a motor level, fine motor skills very good, but communication we see marked regression, no speech at all even at this age, poor eye contact. So here we have child with autism with cognitive impairment, and you are seeing this number of features. Regression definitely after vaccinations, fear of noise with clinging, needs attention, poor socialization, parenting quite cooperative. These are all aspects which you need to take into account to handle the child. So overall, we are seeing mild autism with severe restlessness, destructive behavior with mild retardation and recurrent infection. Now, this is the integrated totality format which we have evolved, where we put what are the sensory issues, motor issues in the child, what is the causation, is there any suppression, and what is happening at the level of affect, emotionality, developmental pattern, disease evolution, physical general, and regression. This helps immensely to visualize the entire child. If we see this child, then fear of dark, noise, this a pronounced sensory pattern you can see. While at a kinetic level, you see destructive, restless, self-biting, tearing things. And post-vaccination, definitely, and tuberculosyphilitic miasm. This is what we see when we perceive this child. And in developmental pattern, we are seeing marked regression of speech and mental milestones. This becomes very important and useful pattern. In some cases, you see uniform retardation, like Barata-Kapp Bufo. In some cases, you can see patchy development, wherein all other milestones might be normal, but one significantly delayed, like Agaricus natrum. So friends, this is a very important aspect, what kind of pattern you are seeing. Disease evolution with pathology. What happened to the child? Whether features came up spontaneously or after some infection. Like in one child, there was mumps, and after mumps, encephalopathy, and post-mumps encephalopathy led to myriad of behavioral and sensory issues. So this becomes a very important evolutionary component, and that child had pronounced obsessive feature, always washing hands, highly destructive, violent, and revengeful, and syphilinum came up beautifully. You see the disease evolution also, syphilis at the level of mind, at the level of body, where encephalopathy had hippocampal damage. So these kind of correlations are very important. In this case, what we are seeing is a functional feature. There are no structural changes. So when we study this, apart from this monomanic obsession, we need to correlate. We repertorize the case: belladonna, stramonium, hyoscyamus, lysine, sulfur. These are the drugs which came up in a predominant way. But when we study that sensory domain is prominent, self-injurious behavior is 3 mark with domain sensory, lysine was given. But what was much more important in lysine was that monomaniac behavior, drawing frenzy. I will tell you the reference. We did not get that immediately from repertory, but we'll come back to that little later when we study the references of this case. Susceptibility is moderate. We gave potency 200 and then later on 1M required. Repetition was weekly. In May 2007, we started 200 single dose weekly and then daily. The patient was made. We gave initially 1 dose, then 3 doses every week, depending on response assessment. And in 6 months, we are seeing 40% definite relief in number of behavioral issues. And then at that time, lysine 200 daily was going on, but irritability, that had also relatively come down now. And gradually we are seeing in November 2007, we see that a sitting tolerance has increased. Shrieking, jumping has almost stopped. Since in February 2008, again hyperactivity had worsened. But by that time, there was definite initiation of the speech. But now at this time, we raised the potency and we had kept him on lysine 1M. Considering the intensity and magnitude of the disease, lysine 1M was repeated daily and then twice a day. Sometimes this mania becomes very difficult to manage and even may require custodial care. The child will go on beating self almost 75 to 80 times a day and then needs close observation, a more frequent repetition, or occasionally in some cases, we may have used, not in this case, but in other cases, acute remedy like stramonium, which may bring about amelioration in exacerbation. In this case, lysine 1M, and then subsequently lysine 10M. At the end of 1.5 years, we can see significant amelioration in all the parameters. The self-destructive behavior had totally gone. Hyperactivity reduced by more than 70%. Communication and speech, against non-verbal, improved substantially, and speech, few words came up even at this age. The score from 73 had gradually come down to 48. You can see significant reduction, and autistic hyperactivity score from 52 to 19. Now, after about 4 months, we reviewed the case. Behavior was much better, but certain sensory issues were still troubling. We reviewed, and now there was still sensitivity to noise. He developed a lot of artistic ability. Now he liked to be hugged, and he developed aversion to fruits. So reviewing the totality, carcinosin was given, and subsequently amelioration took place. No impulsiveness, overall much better. Child settled well, has been attending school. Now, when we go back to Materia Medica and study hearing, you can see hypersensitiveness of all senses, over acute senses, Boger mentions, exalted senses of smell, taste, touch with feeling of anxiety and fear of being alone. Could hear what was spoken in the next room and counting coppers in the room below him. Now, these are all Materia Medica references, which speaks at a sensory level how lysine is beautifully given. Similarly, in self-destructive behavior, as well as in lasciviousness, you can see lysine coming up beautifully. Rapid speech, incessant, even in communication and speech domain. Now, memory for single words, much improved fits of abstraction, quick perception, amazing account of understanding, and rapidity to answer question, superior state of excitement. Now, this is what we see in this boy. He had that perception, he could remember the figure and could reproduce. And see beautifully how Herring describes snapping motions of the jaw, involuntary and spasmodic, passes hands across forehead, and range of ideas extremely limited. If left to himself, is occupied continuously with the same thing and always in same manner. Now, these are various aspects which are given in Materia Medica, which points to lysine, and the number of autistic states are beautifully covered. What are the clinical symptoms which we came up? We also studied like clinging, closing ears, not given, but were ameliorated substantially. Love's music was also observed in number of cases. I'll go through another case with ADHD with pronounced sensory issues. Now this boy, 7-year, came from an excellent family, affluent family, had scholastic performance very poor, quite impulsive, restless, prefers to be alone, poor writing, came from good family. He will move round and round. Parents were so upset because whenever there is function, he will go there, go on moving round and round, quite careless about dress, passes stool in pants, keeps on touching genital. Now this boy, behavior was good initially, but started worsening, and after brother's birth, definitely tremendous aggravation. He was child in joint family, over pampered, milk given when water demanded, so much pampering. But after brother's birth, lot of jealousy and lot of issues which came up. No significant family history except rheumatoid arthritis, ailment from jealousy, regression, involuntary stool, restless, impulsive, fine motor weakness, quite violent. So based on this, we gave hyoscyamus 200. In about 8 months' time, you can see marked improvement in the sleep, violence, involuntary stool. We kept him on placebo, but in July, again, there was worsening. So hyoscyamus 1M was given. In August, overall much better. Now developed maculopapular skin rashes, quite consistent with Herring's law of direction of cure. Exteriorization, skin better. Now says sorry. Earlier used to push people. Now says sorry. Quite aesthetic, curious, and creative. So this is again Herring's law, that how deeper layers started improving so much now. Psychological assessment done, bright normal IQ. We gave here, in this case, hyoscyamus, and then subsequently the whole case was studied. Much later, his defiant adolescent attitude, Naxomica, was given, and then later he had some perceptual difficulty in attribute. But after 3 years active treatment, he was given these drugs very infrequently, but they were quite important. And this is how we see perceiving sequence of remedies in chronic disease, identify what kind of phases come up. This boy, I had forgotten about him. Last I had seen him was around 2013-14. Then suddenly in 2019, I got a WhatsApp message from mother that my son got a dual degree with very good GPA. He complete B.Pharm and MBA. This is the screenshot of WhatsApp. Mother writes, thank you very much. Because of you, he got like this, achieved this. He got placement from college campus and Pune in good company. Thank you very much. I said, glad to know this. Hearty congratulations to your son and proud parents. Mother said, you are the pillar of the success of the child. So friends, it is possible to achieve this. A child who was rejected as ADHD or autistic, having regressive features, parents were worried, teacher said, what will he do in future? Now he holds double degree and is executive. It is possible to achieve by organon-based homeopathic individualized application. Identify phases, see what is happening. But when we study all these cases, we are in a position to identify the syndrome and gives us good insight. Like as I mentioned, that number of sensory cases, phosphorus, Naxomica, China comes up. And when sensory processing is associated with superkinetic energy and stereotypes, Stremonium, Belladonna, Tarantula come up. And when they have regressive features, hyoscyamus, bufo, zincum, and Barata come up. And when you have dispositional feature, then carcinosin, medorinum, nectarmurin, tuberculinum. I would rapidly just go through what came up in our autism study. Everything is published in peer-reviewed journal long back. We had studied these cases for 1.5 years, 6 months prior to intervention, phase of self-observation, where ATC was 72.70 and was majority children were deteriorating and going to 79. Then homeopathic intervention took place, and in a period of 1 year, we can see from 79, it has come down to 64.33. So marked difference of ATC score 6 months prior to homeopathic treatment and at the start of homeopathic treatment. Mean value was minus 6.75. while the mean percentage was minus 9.83. Thus, we can see that there is significant change after introduction of homeopathy, after which mean percentage change has jumped to 19.72. All component of ATs improved substantially, but you can see behavior 29%, while sensory issues 18.82%, which is far, far significant. So we can see the impact where we can have. The most important aspect is in the first quarter, there was 34% improvement in autistic features of the case. In general, each case, we can see average 34% improvement in the first quarter. And why this is so important? Because Autism Research Institute, New York, the founder writes that whenever there is other therapeutic modality given, and if improvement takes place in first quarter, then the credit goes to the new modality which you have given. So here the credit can be given to homeopathy, which was introduced and which brought about 34% improvement. We had studied 60 cases, 24 had mild autism degree, 27 moderate, 9 severe, and 13 dull normal. Now, what is interesting to see is that in all these cases, 26% had mild improvement, 35 moderate, and 26.67 had marked improvement. Worsening occurred in 3.33% and status quo in 8.33. So there was definite improvement, and we could see that almost 60% of cases showed significant improvement. Now, as I mentioned to you, 32 cases of autism where impact of homeopathy was studied on cases receiving occupational therapy. These children were studied for 6 months when they were receiving OT, and they were referred by therapists and educators so that we could see the differential aspect. In those cases, 32 cases, 76 was the score initially, 70 was the score, 73 it became, and with homeopathic intervention, it came down to 46 in the span of 2 years. So this is what we are in a position to observe. Almost 43% in sensory component. Homeopathic medicines have profound impact on sensory issues and bring about its correction fast. Homeopathy is the only science which can modify sensory processing impairment. It is possible to bring about reduction in autistic, ADHD, and LD features, and thus we can rehabilitate child in mainstream society through organon-based homeopathic approach. Friends, I'm really thankful to LMHI for this opportunity. Thank you, dear moderator, Dr. Ibrahim, Dr. Vanlo, all other dignitaries. I will acknowledge Dr. Rupen, my colleague, who has worked with me, as well as Dr. Jawahar Shah, who also helped. Thank you all.
Thank you so much, sir, for a wonderful presentation. As always, it's always a pleasure and honor to listen to you, to learn from you. Thank you so much for this wonderful presentation. Okay, okay. So now, may I request Chairperson, okay, Dr. Sangeeta and Dr. Wanlop, okay, to initiate the discussion so that okay we can discuss with all our four presenters. Thank you so much. Yes, Dr. Sangeeta.
Yeah, thank you, Dr. Abraham Usman Mahister, for a wonderful conduction of the program. With my, closing remarks, I wish to commend you all on brilliant presentation on the theme Experiences in Chronic Disease Management. Now, as this conference marks a significant milestone with over 4,000 delegates from over 60 countries together for a marathon conference. Now, the deliberations made are equally noteworthy and the recommendations are also momentous. Although the efficacy of homeopathy has been demonstrated in the treatment of several individuals, historical review illustrates the role of homeopathy in the management of chronic diseases. The current session reflected on some very interesting topics and explicit experiences of well-known and internationally acclaimed homeopaths in treatment of chronic diseases. We heard speaker Dr. Ronko from Japan, who illustrated with the help of two cases the contribution of homeopathy as a complementary support for Parkinson's disease patients and improving their quality of life. This shows the benefit of homeopathy in elderly, especially in progressive diseases, where most important objective is to improve the quality of life. I would like to congratulate Dr. Ronko, who has played important role in making homeopathy popular in Japan for their exceptional presentation. Dr. Praful Barvelia shared results of study conducted on cases with autism, ADHD, and learning disability at the Spenden Clinic. An increasing number of parents turn to homeopathy for treatment of such neurodevelopmental disorders. The holistic approach of homeopathy and harmless treatment methods that can be given as standalone or as add-on. Now, there are several studies conducted by Jennifer Jacobs, Heiner Fry, that provided scientific evidence of the effectiveness of homeopathy in the treatment of attention deficit hyperactive disorder, particularly in the areas of behavioral and cognitive functions. Homeopathic approach of taking into consideration multifactorial phenomena like the biological, psychological, psychodynamic, and maternal state during pregnancy is unique strength of homeopathy. The team at Spanden is dedicatedly providing holistic care to such patients, and their outcomes is encouraging. I wish that more robust clinical trials can be undertaken on this topic. In addition to this, session by Dr. Aaron To from Hong Kong was also very insightful. I must congratulate him on his exceptional work and presentation today, highlighting role of homeopathy in chronic hepatitis B patient and seroconversion after individualized homeopathic treatment. In case series, which was showcased today, was of high quality and included all aspects of standard reporting. The topic is innovative and presentation evidence-based. The opening session by Dr. Praveen O'Brien was suggestive of methodological issues found in the published literature related to homeopathy clinical trials. It is noteworthy to see the observations and challenges found in published papers. The outcome will only help to improvise so that important data and evidence are not missed due to poor methodology. In today's time, for any pathy to flourish, we need evidence-based research. She has given multiple examples and she has also talked about the guidelines, how to improve our methodology. With this, I would like to conclude the session with a quote so that many robust, high quality studies are undertaken, especially in chronic disease, to add to the evidence base for growth and development of homeopathy. The greater practical value of Hahnemann's theory of chronic diseases has never been fully appreciated because it has never been fully understood. Thank you so much. Anybody who would like to ask questions from our presenters?
Thank you so much, actually, Dr. Sangeeta ma'am, for your wonderful okay, a wrap up, I would say.
Mm-hmm.
So maybe like we can request our Dr. Wanlap also to share
Yeah,
his views on presenters, just in short.
yeah,
For my,
If
sure.
you don't mind, do you mind if we can announce on our CPT code to our Chinese colleagues, because this lecture would be a CPT section for them. I will speak in Chinese. 咁大家咧，我哋呢個 CPT 曲係喺今次嘅嗰個 CPT 曲咧係幾多啊？我哋今次嘅 CPT 曲咧係 HF 019C HF 019C。Thank you very much.
Yes, thank you very much. I think Dr. Sangita has completed the conclusion of the whole things already, and I don't have much to say more, but I just want to thank everybody who made the great representation and presentation, a good one here. So thank you very much.
thank you so much, sir. Still, like, okay, we definitely would like to thank all our 4 presenters for giving all the wonderful insights into the reality of treating patients with homeopathy, especially in chronic diseases, and with a special mention, okay, of Dr. Praveen, who actually, okay, highlighted the real issues what we are facing, okay, in terms of researches being done in the field of homeopathy. Like as we all know that, okay, like hardly like 20 years back, nobody, not nobody, like I would say that most of us were not much into research mode. But in 20 years, yes, the times have changed, and yes, definitely we need further improvements. With such wonderful presentations from so renowned practitioners like our Professor Barwalia sir and our Professor Aaron and so on, like when these people, when they share their experiences with all budding homeopaths especially, so that would make the world of difference, and that one will encourage not just our homeopaths but even the patients and the society by large to change their perspective about homeopathy and homeopathic practice. Thank you so much, Manchanda sir, for giving this opportunity, and all LMHI, the committee, for this wonderful session. Thank you so much. Thank you once again.
Thank you.
Thank you.
Thank you so
Thank
much,
you.
everyone, for being here. Thank you so much, everyone, for sharing all those precious pearls from the researches that you have done, which will obviously combine together to form a big crown over the theme. Thank you so much for being here. Before ending the session, I would love to request everyone, if everyone could please turn on their cameras and put a big smile on their face so that we can have a group photograph together. I would request our IT support team to please have a group photograph.
Thank you.
Thank you. Thank you so much, everyone. Have a good coffee break. The next session is all about to start in 5:30 CET. Till then, have a great coffee break. See you all soon. Thank you so much. It was a really insightful session.